So my name's Gage. I'm originally from the Central Valley in California. I went to med school in Arizona. I am a second-year resident. Going into the third year, I'm going to be one of our chief residents.
Excellent. So what attracted you to our program?
So I was lucky enough to have the opportunity to rotate through as a medical student, and I was really impressed with the training, the level of training that the residents receive here. As a medical student, I saw second-year residents early in the year running resuscitations with confidence and incredible competency. I was impressed at the level of skill and knowledge that they had in regards to handling critically ill patients and tackling procedures. I also, in terms of the program itself, was really impressed with the structure that we have in place to help build that responsibility over the course of the residency. It was something I didn't really see in a lot of the other programs that I rotated through or interviewed at. And I liked that structure in terms of building you towards being able to step out into the world as an attending with confidence.
So you're just starting overnight flex shift?
Yes, I am.
Where you'll be the senior in charge. So when you leave that shift in the morning and when you leave this residency in a year or so, what are you going to be most happy about in terms of your decision to train here? What do you think is going to be most beneficial to you in your time here?
I think probably the most beneficial thing about training here in Jacksonville is the variety of the patients that we see. So on a flexible care shift, we will see anything from a simple toe pain all the way up to shortness of breath that might have something serious going on, critically ill patients, septic patients. So we see a wide variety of patients and a wide variety of complexities of medical problems. That breadth of patient population provides a really great opportunity for learning. I'm seeing a lot of different things and getting exposure to a lot of different things. So I think when I leave my shift, I know I'm going to have seen multiple things. But I think ultimately when I leave the program, I know that I'm going to at least have had exposure to a lot, or the majority of patient kind of presentations.
And I want honesty here, and this will not hold anything against you. Okay. What is your least favorite part of the program? And when you leave, what are you going to be so happy to leave behind?
With this being a county program, it has benefits as well as challenges. So just as beneficial as that variety of patient population is, our patients are poorly funded. Our hospital a lot of times is the safety net. I often get frustrated at patients checking in who've been discharged from other hospitals and told to come in here to be taken care of. We're working a lot of times with limited funds and limited resources and trying to do the best that we can to take care of patients, and that can be a little frustrating and draining over time.
So to wrap up, a lot of students aren't going to have the benefit of rotating places they may want to go next year. So what type of student do you really think should train here, and what type of student do you think should pass this up for a different type of program?
I think the kind of student that should train here is someone who has the ability to self-motivate in terms of learning outside of shifts. There's going to be some direction, but it's really going to need to be driven by your motivation to read and to follow up on things. So if you're looking for someone to kind of hold your hand in terms of that didactic part of things, this is probably not the program for you. In terms of, speaking from the female perspective, this is a program that requires you to use your voice. So you can't be afraid to be the loud voice in the resuscitation, regardless of what other people might think about that. So if you're someone who hesitates to be that person to step up and be that loud voice, then again, this is probably not going to be the right place for you.
Cool.
Good?
Okay. Thank you.